So this is a big problem with medication where half of the time people, especially if it's something like stimulants because it improves your mood and releases dopamine and is a little bit euphoric, people think it helps way more than it actually does. And on the flip side, for a lot of medication that does help a lot, people feel like it doesn't help very much at all. So with medication, it doesn't fix anything, really. All it really does is symptom improvement. Hello, Internet. My name is Dr. Alok Kanoja. I spent about 7 years studying to become a monk, wandering around India and East Asia, and then ended up training to become a psychiatrist at Harvard Medical School, where I specialized in evidence-based complementary and alternative medicine. And the most common questions that I get as a psychiatrist are, first of all, do I need to take medication? Does medication even cure anything? Am I going to become dependent on medication? And I also get a lot of questions from people who are super interested in meditation. So these are the people that would come to my office. They're like, can I use meditation or spirituality or something like that to cure my depression, cure my anxiety? I don't want to put anything artificial or pharmacologic in my body. So today we're going to talk about those two things. So the first issue around medication that a lot of people are concerned about is, first of all, it's not curative. And since it's not curative, they may become dependent on it. So my take as a psychiatrist is that medication is vastly overprescribed and vastly underprescribed. So I think there are too many people in the world today who are on way more medication than they should be. And I think there are a bunch of people who are so resistant to medication who would absolutely benefit from it. So how does this work? So medication, especially in psychiatry, doesn't cure things. In general, in the field of medicine, we have very few medications that are curative. So antibiotics are curative. You have an infection, you take a course of antibiotics, you never need them again unless the infection comes back. We have some cases of even like rare forms of cancer, I wish it was more cancers, where we can give you some kinds of biologic agents and even basically cure certain things like chronic myelogenous leukemia. But the majority of medicines that we prescribe as medical doctors are not curative. So great examples of this are like hypertension or blood pressure medications. Once you have high blood pressure, unless you make certain lifestyle changes, you will probably need to be on that medication for the rest of your life. And psychiatric medication is no different. So people are correct that taking a medication will not cure you of anything, but will you become dependent on it? That's actually on you. Hey y'all, if you're interested in applying some of the principles that we share to actually create change in your life, check out Dr. K's Guide to Mental Health. And so we start by understanding what literally is meditation. How does experience shape us as human beings? How do we strengthen the mind itself as an organ? And so by understanding our mind, we understand a very, very simple tool, a crucial tool that we have to learn how to use if we want to build the life that we want to. So check out the link in the bio and start your journey today. So let's understand a little bit about how psychiatric medication works. For the most part, psychiatric medication treats symptoms. It does not treat the root cause. Now, a lot of people will say, since it just treats symptoms, I don't want it. I want to focus on the root cause, which I'm all in favor of, and we'll tell you all how to do that. But here's the key thing to understand. Altering your symptom profile significantly alters the trajectory of your life. So let's take a quick look at schizophrenia. This is an example of a disease that we think of as being degenerative. So people basically don't usually get cured of schizophrenia. So only 1 in 7 patients are likely to meet criteria for recovery. That's really bad. These findings could easily be reconciled if schizophrenia could be established to be a progressive brain disease. Results from longitudinal studies of brain structure, cognitive functioning, and clinical outcomes, however, do not support this view. The poor outcomes so commonly observed are likely best explained by poor access to treatment, poor engagement in ongoing care, poor treatment response, and poor adherence together. Right? So basically this is a paper that's advocating that schizophrenia is not a degenerative brain disease, but the reason that things are so bad is because people aren't getting sufficient treatment. So let's take a look at what the outcomes actually are. Compared with the treated patients, those who were never treated in 2008 were significantly older, had significantly fewer family members, had higher rates of homelessness, death from other causes, being unmarried, living alone, or being without a caregiver, and poor family attitudes. So if we look at studies on treating mental health, what we tend to find is that even though it's not curative, people who receive treatment have a different course in their life. So I'll give you all a simple example of this, okay? Something that I struggled with a lot. So when I was a freshman, I probably would have gotten diagnosed with depression if I went to go see a mental health professional. And here's what I want y'all to think about. Let's say I start an SSRI or an antidepressant medication that reduces my depression by 30 to 70%. If I'm a freshman in college, how much of an impact does 1 year of cutting my depression in half have on my life as a whole? So if I fail 1 year of college, what does that mean for my likelihood of graduation? What does it mean about my rank? Am I going to graduate with honors? Am I going to graduate at all? Am I going to graduate without honors? What does it mean about my relationships with my professors? What does it mean about my social status, right? So if I fail out of college or I have to repeat a bunch of courses and all the people I met during freshman orientation are now sophomores, what does that do to my social life? When I'm a second year freshman, how do I behave when I'm meeting other people? Oh, what year are you? Well, this is my second year, but I'm repeating all my intro courses. Oh, you're in intro to philosophy? I am too, but I've been here for 15 months and you've been here for 3. How does that alter my social life? If it alters the way that I graduate, does it alter my job prospects? If it alters my job prospects, does that alter my capability to find a long-term life partner who respects me because I have a well-paying job or because I'm a college dropout? So what we see in psychiatry, and this is what the studies in schizophrenia show, it doesn't cure anything, but it significantly alters the course of people's lives. And you don't have to be on treatment for long-term in order to create that kind of effect. So when I think about prescribing treatment, there are a couple of major considerations that I have. The first is, can this person afford to be sick, right? Can this person afford to be depressed? Can this person afford to have crippling social anxiety when they are going to college for the first time and maybe meeting their forever partner for the rest of their life, or forming friendships or joining a fraternity? What is the cost of the mental illness over time, and how can we alter that cost, and can we alter the trajectory of their life? Now, the second thing to consider is that when we take medication, all it does is artificially reduce our symptoms. And this is something I completely agree with as a psychiatrist. Can this have long-term permanent effects? Absolutely. But it just alters your symptoms. The real curative aspect in psychiatry happens outside of medication. So let's take a look at a study on ADHD that really illustrates this. If we look at stimulant treatment for ADHD, what we see is that symptoms improve by about 23% in the first 12 weeks, 28% in the second 26 weeks, and about 30% in 52 weeks, right? So this sort of makes sense. You take a stimulant medication, it works right away, it gives you some amount of benefit, and that benefit does not change over time. And if you stop taking the medication, the benefit disappears. Now, let's take a look at cognitive behavioral therapy for ADHD. 12 weeks, symptom improvement is 5%. 26 weeks, symptom improvement is 20%. 52 weeks, symptom improvement is 69%. And the effects of cognitive behavioral therapy in most studies last around 2 years, if not more. So here's the key thing to understand about medication. One of the biggest problems with psychiatric medication is that human beings are bad at telling the difference between what feels like improvement and what is actually improvement. The majority of patients that I've worked with who like stimulants will say that this improves my life way more than 30%. I am non-functional without it, and I am completely functional with it. But if you look at data for large groups of people over large periods of time, what you discover is that there's basically a 30% symptom improvement. Now, 30% symptom improvement can be gigantic, right? Because, I don't know if this kind of makes sense. If you're trying to, let's say I'm trying to bench press and, I'm kind of stuck. If I have a spotter, the spotter only needs to provide a small amount of force for me to get positive trajectory. So a 30% symptom improvement in ADHD may be the difference between passing a class and failing a class, getting fired and getting promoted. So that a 30% can be huge. But human beings tend to be pretty bad at separating objective outcomes over time over subjective feelings. And if we look at treatments for things like depression, we sort of see the opposite effect, where people don't feel like the medication is helping very much. They don't feel like they're doing better on it. But if you look at outcomes over time and you measure them objectively, what you tend to see is a much larger effect than what people are subjectively aware of. So this is a big problem with medication where half the time people, especially if it's something like stimulants, because it improves your mood and releases dopamine and is a little bit euphoric, people think it helps way more than it actually does. And on the flip side, for a lot of medication that does help a lot, people feel like it doesn't help very much at all. So with medication, it doesn't fix anything, really. All it really does is symptom improvement. Now, here's what I see as curative with medication. See, once your symptoms get better, then you can engage in the behaviors that will lead to a more permanent improvement in your mental health. Just like we said with depression, you know, if I start a freshman on an SSRI and it improves their symptoms by 50%, they end up finishing their class, they end up graduating, they end up meeting someone in their senior year and falling in love, they end up getting a good job, so their partner isn't worried about them, their family accepts them because they got a good job. Now they're getting married at the age of 26, now they're going on vacation at the age of 27, now they're having kids at the age of 30. So even a short course of an SSRI, which then you can pull off, allows you to develop social capital, form connections, accomplish things in your life that you can be proud of. The other things that medications tend to do pretty well is they help us engage better in things like psychotherapy. So this is where like what's curative in psychiatry or more things like psychotherapy. So when we get into, and we saw that with the ADHD stuff, right? The ADHD study, where you know, there are some cognitive patterns that you have. Once you understand those patterns, once you process your trauma, it's gone, hopefully, generally speaking, right? So we tend to see more permanent gains with other forms of mental health activity. Exercise will help a lot. Accomplishment will help a lot. Social situations will help a lot. So when I think about medication, there are a couple of questions that I ask. The first is, does this person have the bandwidth to eat a high fiber diet, start to eat healthy? Do they have the money to buy supplements if that's what they want to do, like omega-3 supplementation, vitamin D supplementation? Do they have the time or luxury or location to learn a meditation class, start doing yoga, start exercising? Do they have enough social support to be able to get through this rough patch, right? Because permanently fixing your mental health is, first of all, a debatable concept. And secondly, is like a lot of work. And so does a person have the energy and bandwidth to do all of that stuff? If the answer is no, then medication starts to enter the picture, right? So let's start with medication. By the way, just statistically, 70% of my patients who come in on medication end up not on medication. About 70% of my practice is not on medication. But medication is absolutely great and absolutely has a role. So when you need a little bit of extra support, when you can't afford to do yoga 3 times a week, exercise for three hours a week, if you don't have a relationship right now, if you're not able to like cook for yourself, if you're financially strapped, then meds can be great. Now, this is the key thing. Once you start the medication, this is where I advocate very strongly for my patients to start doing that other stuff, right? Now that your social anxiety is a little bit better under control, fucking go out and socialize. Start developing your social skills. Now that your mood is a little bit better, sure, you got a C in that class. Now is the time to grind and work extra hard and make up for lost time. You need that extra energy. So I sort of think about medication as kind of like this launching boost, right? So it kind of catapults you back to a normal range. And then whether you stay on it or don't stay on it depends largely on what you do. And a huge part of that is meditation. So now let's talk a little bit about how meditation works. Can you use meditation to cure your mental illness? Do you need meds? My answer is going to be a little bit maybe different from most of my colleagues. So I would say that I have seen a substantial rate of psychiatric symptom remission in patients who meditate the right way and for an extended period of time. Okay? So that probably happened to me. So I probably would have been diagnosed with depression, was failing out of college, was addicted to video games. And through 7 years of meditation practice, I think basically most of that stuff is gone and hasn't really been a problem. So let's understand a little bit about how meditation works and potentially if it could be curative or not. So the first is that the studies on meditation show a mild to modest symptom improvement for just about any mental illness. They improve things in schizophrenia, anxiety, depression, whatever. But we don't see these large transformative permanent changes. Their effect size is probably less than medication in the studies. Now, I think the reason for that is because the studies are looking at 12 weeks. And if we look at meditation, which we're going to talk about, if you practice for years, you will continue to gain ground, okay? So let's understand how meditation works. The first thing that meditation does is an acute physiological change. So one of the biggest complaints that I get about people who I advocate meditation for is they'll say, it helps me while I'm meditating. But as soon as I'm done meditating, or an hour later, all of the anxiety comes rushing back. And that is correct. That's how it starts. So if we look at something like anxiety, anxiety is driven by your nervous system. It's not just psychological, it's physiological as well. Your cortisol levels, your adrenaline levels, all of that stuff will influence your anxiety. So a big part of meditation is breathing. And we know psychologically, or what we know physiologically, is that when you increase the depth of your exhalation, when you extend your exhalation, it calms down the mind. So anytime we meditate, we will calm down our nervous system, which for the duration of the meditation helps us feel better. Now, this becomes really important for my patients with addictions, because when you have a craving, when you have an acute emotional need, the real goal is to not drink alcohol or smoke weed in these 15 minutes. Because once you touch the alcohol, once you touch the weed, that will have a 24-hour, 1 week, 1 month, 1 year effect, right? So even acute changes to your physiological state, acute changes to emotional tranquility, even if they're very temporary, can help a lot. Now, that's just phase one. So if you meditate regularly, and most of the studies look at 20 to 30 minutes of meditation on a daily or every other day basis, what we tend to see is more long-term changes to your physiology. So this is my take on it. About 20 minutes of meditation is what it takes to shut off cortisol production. And cortisol floats around in your system for about 24 hours, or exerts effects that float around in your system for about 24 hours. So it activates gene transcription and stuff like that. So it alters your cellular metabolism for about a 24-hour period. So if you can shut off cortisol production for even a window of an hour or two every day, instead of it constantly being pumped out because you're stressed about this and worried about paying rent, that will change your physiology over time. This is not an acute effect. Once we shut off cortisol, we are altering the ways that our cells function for the next 24 hours. So what I would kind of say is, if you think about something like trauma, what trauma does is hyperactivates, elevates your baseline physiologic activity. So even normal things feel scary, right? So I feel frayed and on edge because my brain is really jittery. Small things will create big responses. So in the same way that our set point for anxiety can be increased by trauma, our set point for anxiety can be lowered through extended use of meditation. So we start to see a physiologic rewiring. Now this is different. This isn't an acute effect. Now our baseline set point is lower. And there are a bunch of studies that show this through something called heart rate variability. So heart rate variability is our measure of the body's ability to adapt to different situations. And what we know in people who are chronically anxious is that their adaptive window is really small, because even at baseline, they're like in a high stress situation. So you can't elevate your stretch much more beyond that. They're like kind of stuck in this narrow window. So extended periods of meditation will alter your physiology, increase your heart rate variability, and this is a more permanent change. But it goes even beyond that, because these are sort of the physiologic parameters. The next thing that we can look at in meditation is actually brain changes, right? So forget about the body for a second. But meditation drastically alters the way that our brain works. So we know that meditation improves our attentional control. So meditation improves ADHD because it trains our brain to focus on one thing. But there are a couple of other subtle points here which are really important. So if we think about the practice of meditating, I'm going to focus on my breath. And what happens? I'm sitting there focusing on my breath, and then my mind wanders. I think, oh, I want to play this video game, or I have to pick this up. And then what do I have to do when I meditate? I have to bring my mind back to the breath. And a lot of people think that they're bad at meditating because their mind wanders a lot, and they're bringing their mind back to the breath, bringing it back. I can't concentrate for 20 minutes. I can barely concentrate for 30 seconds. That is actually really, really good. So every time you bring your mind back, you are doing a mental push-up. You are saying to your brain is saying, hey, instead of focusing on that, focus on this instead. Instead of focusing on that, focus on this. Instead of focusing on that, focus on this. Instead of focusing on that, focus here. So you're training your brain to focus where you tell it to focus. Now, this absolutely helps with things like ADHD, because if we get distracted, we get better at coming back to the point, get better at coming back to the point. That will allow us to stay on the breath for a longer period of time. That will allow us to stay focused for a longer period of time. But this is also important for something like depression. So what happens in depression? What happens in major depressive disorder? Our mind becomes hyper-focused on one thing. Oh, I'm hopeless. I'll never meet anyone. I'll be alone for the rest of my life. And then people will say like, hey man, like think about the big picture, take a step back. And our mind is not able to do that. So if you look at mental illness, a lot of mental illness correlates with perseveration of the mind. When someone is anxious, you can't shift your mind away from what you're worried about to something that is more peaceful. That's why we get addicted to like substances and technologies, because they do that work for us. So I'm hyper-focused on how hopeless my world is. I'm hyper-focused on how I'm feeling anxious at a dinner with my friends. I can't enjoy the food. I can't enjoy the conversation. I'm stuck in my own head on a date. So this shifting of attention is huge for basically every dimension of mental illness. When I work with people who have schizophrenia, and they have auditory hallucinations or persecutory delusions, what I will help them do is ignore them, right? So, oh, you're like here, you're eating a fish sandwich and the devil is telling you that you're going to burn in hell forever. Let's learn to shift our attention away from that and enjoy your sandwich. And there's studies that show that this actually is helpful, right? So it's crazy. So attentional control is the first piece. The second thing that meditation improves, and this can be like a neurologic, basically permanent change, is an improvement in willpower. So in meditation, you feel like doing a lot of stuff. So when I have a sitting practice where I'm supposed to meditate for 30 minutes and I'm going to do 108 rounds of a mantra, I feel like getting up. I don't want to sit there. I don't want to meditate today. I want to scratch my back. I want to shift away. I don't want to sit in this like rigorous spine straight meditative posture. There are all kinds of things that I don't want to do when I meditate, and there are all kinds of things that I do want to do. So meditation, we also know, improves your frontal lobe function, which is essentially your ability to restrain impulses, your ability to focus, your ability to exert willpower, and that improves over time too. Because every day when you sit down to meditate, you don't want to meditate. You don't feel like sitting there. And so each time you do that, you are training your brain to ignore what it wants to do and instead focusing it on what it needs to be doing or what it should be doing. So this is just a simple way to level up your willpower. The third brain change that we tend to see is a change in emotional regulation states. So we sort of talked about that from a physiologic level, but over time when we meditate a lot, our brain, the part of our brain that regulates our emotions, tones down our anger, tones up our happiness, steps away from our anxiety, actually improves over time. So this is the best example of this is when dialectical behavioral therapy was developed. A big part of this was grounding techniques. So DBT was developed for a diagnosis called borderline personality disorder. And one of the key problems in borderline personality disorder is that these people's brains experience more emotion. So if you get like broken up with, like if you get dumped by your partner, you will feel 8 out of 10 sad. When someone with BPD gets broken up with by their partner, they will feel 12 out of 10 sad. And you may say, but Dr. K, you can't do that. You can't have 12 out of 10. This is exactly my point. The capacity of emotional distress that their brains are capable of experiencing is higher than normal. Not only do they feel more emotional pain, but the frequency of emotional pain goes up, so they feel sadder more often, and the duration of emotional pain is increased. So they feel sadder more often than you do, more intensely than you do, and it lasts longer than it does for you. The cool thing is that when we developed dialectical behavioral, or we didn't develop it, Marsha Linehan developed it. She's someone with BPD who learned how to meditate and was like, wow, this is what was missing from my treatment. So when we teach these people grounding techniques, it improves their emotional regulation skills. It improves their distress tolerance skills. And if you think about what are the things that really screw you in life, it is the inability to tolerate and regulate your negative emotion. Since I'm feeling socially anxious, I'm going to avoid going out with people. Since I'm feeling really, really angry at my boss when they give me bad feedback, and I get so pissed at them that I don't critically look at the information they're giving me, and then I don't improve my work performance. I just get mad and I blame them, which over time means that I'm not going to do well. When I'm feeling sad, can I regulate that sadness, force myself to get up out of bed, go clean things, go walk around, get some sunshine, improve my vitamin D? So this is where emotional regulation, willpower, and intentional control are all improved by meditation. Will have relatively long-term, if not permanent, maybe not permanent, but long-term neurological effects that will improve mental illness. Now we're going to leave the science of meditation behind and talk about two other effects, which there's some evidence for, but this is really more from the spiritual tradition, and it's kind of what I've seen in my patients and what I've experienced personally. The first is that we know that meditation affects your sense of ego or your sense of identity. So there are studies that show that when we look at psychedelics, there are studies that show that the kind of trip you have correlates with the level of improvement with depression or healing of trauma. And basically, if you look at all the studies on psychedelics, the studies that involve an ego death experience, it doesn't work. If you just see cool patterns and you're just tripping and it's fun, that doesn't work. What seems to correlate with the most psychological healing and symptom improvement from PTSD and mood disorders like major depressive disorder are actually ego death experiences. So the more ego death you have during a psychological trip, the more healing you will see in terms of trauma and depression. Now, this doesn't mean that you should go and take psychedelics, because the other problem with ego death experiences is that they can really screw you up. So psychedelic experiences of ego death can have profound negative effects on people too. But we kind of know that the healing comes from ego death. And let's understand that for a second, right? So if I sort of think about, like, let's say I'm at a party and I feel like dancing and I just want to enjoy myself, but I can't enjoy myself dancing because I'm afraid of what people will think of me, right? They will judge me and I don't want them to judge me. That is an ego-oriented thing. So the person who's out there on the dance floor just living their best life are the ones that don't care what other people think. In order to not care what other people think, you can't be trapped in your own sense of ego or identity, right? So it's the maintenance of my image towards other people that restricts me so much in life. I can't afford to make mistakes because I will look stupid. Therefore, I hide my mistakes. Therefore, I never correct my mistakes because people don't give me constructive feedback. I can't receive constructive feedback. I can't actually improve. Instead, I have to hide everything that I do. I can't look like an idiot. Therefore, I have a zit on my nose today. Therefore, I can't go on a date. So if we really look at it, ego restricts us in life, right? Instead of actually living life, taking chances, learning from our mistakes, putting ourselves out there, we are so concerned about our image and how other people will treat us. We find it so devastating when people treat us poorly instead of acknowledging, hey, maybe I did something wrong and maybe this person is an asshole. Ego gets in the way in a huge way. So when we meditate, at the beginning, you're focusing on your breath and then you're having all these thoughts and you are a human sitting there trying to meditate. But then you will enter a certain state of consciousness where you have awareness without thought. You're not thinking about anything. You're not worrying about anything. You even stop to be a human. You're just one with the breath. This is a Sanskrit phrase called dhyan, which is a state of mind where the object of the meditation and the meditator merge into one. So you kind of lose yourself in the meditation. And my take on this as a psychiatrist who develops these techniques for patients is that spending time in an egoless state is really good for you. So there's a really interesting opposite of this, which is social media. So social media is all about ego. It's about my profile, my likes, the way that people perceive me, who I follow, who follows me, who comments. Do they like this? Do they not like this? So social media is all about projecting our ego out into the world. And we know that the more you use social media, the worse your mood gets, the worse your anxiety gets, the more body image issues you have. So we actually see a lot of evidence that egoless spending time in egoless states improves your mental health, and spending time in ego-full states worsens your mental health. Now, the last thing about, improvement when it comes to meditation goes even beyond that. Now, this is the stuff that we have very little evidence for, which is sometimes when people meditate, they will have a profound spiritual transcendental experience that's a little bit closer to something that's like psychedelics. Now, this kind of goes beyond the scope of what we're discussing today, but those experiences can be powerfully transformative and powerfully healing. So Kundalini awakening is like a good example of this, where the science just isn't there yet. So meditation has been developed over 6,000 years, maybe even longer, and we've only been studying it seriously for about 20 years. So there's a lot of stuff in meditation that it's not that it's not true, it's just that our scientific methodologies have not been focused on that for nearly as long. And we don't have good enough instruments to really detect what is going on in a transcendental spiritual experience. So the biggest mistake, in my opinion, on the meditation versus medication debate is how reflexive people are. So if you kind of think about it, if someone says, oh, I don't want to take medication, they don't critically look at why that is. If someone says, oh, I want to meditate instead of go see a psychiatrist, I want to heal myself naturally, they don't critically look at where that belief comes from. What are they avoiding? What are they afraid of? What are they longing for? So the first thing that you should do is be critical about your beliefs. Why do I believe this stuff and where does it come from? Second thing about being critical is what do you really know and what do you really not know? So the majority of people who make the wrong decision here, in my opinion, are people who are largely ignorant. They don't really understand how that psychiatric medication, just because it's symptomatic treatment, doesn't mean that it can't alter the trajectory of your life. Whether you become dependent on it or not is not about the medication. It depends on, once you start to feel better, are you willing to put in the work and effort to fix things in a more permanent way so that you can come off of the medication? So be critical, don't be reflexive. The next thing is that I think try them both, right? So I think the best advice is to go see a mental health professional where you lay out what your challenges are, what your goals are, and then you see if medication is appropriate for you. You understand how it fits into your path to healing and health. And at the same time, you give meditation a shot. If you're someone who's loved your Adderall prescription, your stimulant prescription for 10 years and you can't live without it and lets you function, try meditating. And for a lot of people who say, but I can't meditate on ADHD, I have a lot of trouble with that. So if you want more information about all this stuff, we have Dr. K's Guides to Mental Health, where I go through my approaches on medication, meditation for depression, for anxiety, for ADHD. We teach all specific practices that will help you with particular problems. There's a guide to trauma as well. So if y'all are interested in more detailed information on all these topics, definitely check those out.